Yeah, you look so beautiful, as always.
We are visiting the MFM clinic in labor and delivery to drop off some thank you gifts. It's amazing. There were a few times during the pregnancy we weren't sure, what was going to happen or if we were even going to make it this far. So it was really exciting to come back with a happy ending. So we started coming to Riley after we lost our last son in 2021, and we had received the diagnosis that we are dealing with Andrew the same week that we found out we were expecting him. So that was kind of rough.
Brittany had a scary, overwhelming pregnancy, but she handled it like a champ. She's a super mama. So Brittany had a complicated first pregnancy that after we saw her in our MFM clinic before she got pregnant this time, and we did a lot of blood work for her, we found out that the reason of her prior pregnancy being complicated most likely due to antibodies in her blood that basically went through the placenta to the baby back then and caused some of the issues of breaking the blood cells of that baby. When moms have such a complicated first pregnancy like hers in the past, there's a very high chance that this will happen again, and even earlier this time. So we suspected that she will start having this baby anemia even very early this time. So then we talked about a medication that is called IVIG. IVIG is basically immunoglobulins that neutralizes those antibodies that she's forming and going through the placenta to the fetus or to the baby in the womb. Did wonders in her case. It helped to neutralize these antibodies. It helped push her pregnancy further until 24 weeks, then when we started seeing severe fetal anemia. And then when we decided, okay, now this is a good time to go in and give blood to the baby. And that's when we started her journey of doing those intrauterine transfusion procedures. Because when there is an anemia, we cannot really go in and give blood to the baby unless baby at least 18 or 20 weeks. Before that, the vessels are very small. Even our smallest needle, which is 22 gauge, cannot go into these vessels and will cause even more harm than benefit.
Just the level of care that we received during, we've been here a lot since January for different treatments and things, and everyone's just been amazing.
It was magical too when moms decide to come back to our clinic and bring their babies. I see those babies on ultrasound almost weekly sometimes, especially for these complicated pregnancies. And I feel like I know them. I know this baby. I've seen it like every week. So when she decides to bring it and I see the baby's doing awesome and made it to a good weeks of pregnancy, big and cute and snuggly in the car seat, it's just one of the best moments I could dream of.